My main role as the laboratory client services manager is to make sure that my team has the tools and resources they need to do their job and support our patients. So every day I come in, I evaluate our patient volumes, our patient population types like isolation patients, evaluate staffing, make sure that we're able to keep up with the demand of the morning rush, I should say, for morning labs and shuffle staffing as needed. And then after I make sure that we're able to staff appropriately, I move on to my projects and check in on Pine Lake Lab. So out here at the service center, check in on any service line disruptions that we might have, so supply chain issues, and just follow up with any of the exciting things that present as a laboratory manager, such as patient follow-ups or provider follow-ups. No day is the same. In healthcare, whether there's a pandemic or not, there's always something new that pops up. So. My job changed to a very COVID response focused role initially when the pandemic started. I went from maintaining and maybe improving routine services to being focused and lead on bringing in testing for COVID, and making sure that we were able to serve our community and bring in COVID testing at high volumes. So when you think back to the early days of the pandemic, it was all about COVID testing. Where can you get COVID testing? It was something that had to be developed, and so we were kind of in a race to have that accessible to our patients and not have to send it out where results were taking up to 48 hours. So that was the biggest change to me, is bringing in new testing methods, and not just one method but multiple methods, and making sure we had the services for our inpatients who are sick, but then as we progressed into end of 2020, early 2021, how can we support the community as well? And so that's out here at our Pine Lake Laboratory for the Imaging and Diagnostic Center. We implemented on-demand testing. So we had a service where we supported people who needed to return to work because they had been exposed, or travel testing, so people needed to travel. So so much of my job just focused on COVID response and learning how to do things and being able to say yes and what do I need to get this done. So we do feel that, and honestly, in the medical laboratories, science profession, we were feeling that before the pandemic. Not a lot of people know about laboratory medicine and the role that we play in healthcare and patient care. And so we were trying to prepare for it before the pandemic, and the pandemic really escalated it. As you said, we've really suffered with with our staff being out sick, especially during this most recent Omicron surge. But people hoping to get people to come and work in healthcare when there's such a spotlight on how hard healthcare can be, and having to step up to the plate when we're in a global pandemic. We've definitely noticed that. We've had new phlebotomists start, or people who are just I can't maintain this level of service, or this is just so intense that this is just not going to be the career for me, where maybe when it wasn't a pandemic it would have been the right fit for them. And so we've seen a lot of that, and people just really realizing whether this is for them. It's been hard these last couple years, and there's been days where I'm like, oh, this is so exhausting, but I think back to what brought me to healthcare. I always knew I wanted to make a difference in patients' healthcare, in their lives and in their treatment, and just remembering the role that I play, not only to the services that I provide and that I lead, but to my team. My team members are the ones on the front lines. They're the ones who are dealing with regular inpatients to our COVID-19 patients, and just being that support for them, and being there for them is what keeps me at it, because and I would like to say it fills my bucket to be a part of a response to the community, like COVID related or non-COVID related, the projects where I can walk away and feel like I've made a difference. Um, that's what keeps me going. In healthcare sector, I think it's important that a light is shown on like how many different career paths there are in healthcare and how to make a difference in healthcare. There's nursing and doctors that play major important roles, but also there's respiratory therapists, radiology technicians, medical laboratory scientists. There's so many careers that people have a choice to go into, and just getting education out there. But also one thing that like we've noticed throughout the pandemic is support that employers provide to their team members. Culture and team member support is huge, making the staff feel like they're supported in their current day-to-day roles, but also supporting them maybe with like tuition reimbursement. Like your company is going to invest in you for the investment that you made in your career to be in healthcare, and that's what I think is going to help retain and recruit, is to know that they have support when they join that healthcare team.